Type 1 diabetes has become a global health crisis, with an estimated 35 to more than 40 million people affected worldwide, and the incidence is rising rapidly in all populations. The good news is that multidisciplinary research efforts are promising to solve the diabetes puzzle. From technological approaches like the artificial pancreas to so-called smart insulin that is automatically activated or suppressed in response to blood sugar levels. And several groups are developing beta cell implants that utilize a variety of immunoprotective strategies, including stem cells and nanoencapsulation, to protect those replacement beta cells. But for our purposes today, we'll focus on several cell-based approaches aimed at restoring immune tolerance of beta cells.
I was losing a lot of weight. I noticed that me and my buddies started at the same weight when we started the trip, but after the first 2 or 3 weeks, all of a sudden he seemed really muscular to me.
Spencer Frank was 23, backpacking in Southeast Asia when he became very fatigued. His blood sugar had gone to 300. When he returned to grad school, he volunteered for a Phase 1 diabetes clinical trial at UCSF, the University of California at San Francisco, under the direction of diabetologist Dr. Steve Gittleman.
So we looked at, what's the output? How much insulin can a given individual make before the treatment, and then in sequential visits back to our center over the ensuing 2 years. And about half the subjects did remarkably well. In fact, their beta cell function looked stable over that 2-year period.
What allowed the apparent stabilization of Spencer's diabetes, even in a Phase 1 safety trial, is based on work in the UCSF lab of Dr. Jeff Bluestone. He and colleagues have learned how to identify and isolate from a diabetic patient a subpopulation of T cells in the immune system called Tregs, short for T regulatory, that are defective in type 1 diabetics. When these Tregs are greatly expanded in number in the lab and given back to the same diabetic patient, something remarkable happens.
We put back in 1 billion or 2 billion of these cells. We put in a lot of them. But also we know after this 2-week period in which we grow them that they work better. We've fixed some of the defects that we identified in these patients to begin with, and the cells that come out the other end are better than the cells that we took out of the person's arm. So we're not just putting back more of the cells, we're putting back better cells.
And it looks like this resets the delicate balance in the immune system to prevent autoimmunity. A Phase 2 trial is getting underway to validate the concept. A different approach to rebalancing the immune system appears to have helped young Ivan Chudnovsky, a brittle type 1 diabetic.
I went out to the playground and I played like 20 or 15 minutes, and then I ran back to my mom and sat at the bench because I couldn't walk.
When conventional therapies didn't help Ivan, his mom took him to China for an innovative and unconventional immune system reset. That approach is now being elaborated in this lab at Hackensack University Medical Center, where the innovator, Dr. Yang Zhao, has come to prepare his technique for a U.S. clinical trial. It uses umbilical cord stem cells to reset Treg cells into tolerance.
The stem cells can release the signal to the patient cells, can educate the patient immune cells, just like a teacher educated the students. They can correct their function defects, then return the cells to the patient.
Dr. Zhao accomplishes the Treg re-education by adhering umbilical cord stem cells onto the bottom of a series of stacked petri dishes. After extracting the patient's T cells, he percolates them through the dishes, where they interact with the stem cells. What makes this process even more noteworthy is what happens when these re-educated T cells are returned to the patient.
Once those cells get back in the body, they go find all the other activated cells, and they tell those cells, wait a minute, guys, you're off base. You don't want to attack that. That's part of us, and it shuts the whole thing down.
Big difference. It's very huge difference. It's before he can play just 10, 15 minutes. Now he jump in 2 hours non-stop.
But whatever method is used to shut down the autoimmune attack, The destroyed beta cells still need to be replaced. There is some evidence for beta cell regeneration, but most type 1 diabetics will likely need a fresh supply of insulin-producing cells, something Dr. Eckhart Alt of Sanford Health says begins with obtaining stem cells from small amounts of fat.
And then we take that as a raw material to put it in culture and drive it through the differentiation. So we will get enough cells. The cells in young people take about 24 to 30 hours to double. That means if you have 1 million cells, it takes a little bit more than a day to come to 2 million, and then it goes exponentially up. So you have bioreactors. So the lack of cells is no problem. The benefit is there is no risk of transmission of diseases. So it's not cells from somebody who might have hepatitis or some other disease. It's your own cells. That makes it very safe.
Millions of diabetics around the world hope that one or a combination of these techniques will finally be the cure they've been waiting for.